Good morning. I'm Elena.
I'm Tiffany.
I'm Valerie.
And I'm Teresa.
And today we're going to present to you about the role and benefits of occupational therapy for older adults. So at the beginning, we have a couple of learning outcomes that basically you're supposed to get by the end of this presentation. And the learning outcomes are understanding the field of occupational therapy, understanding the importance of an occupational therapist in an older adult setting, conveying the importance of occupations, comprehension of standardized assessments, understanding the importance of treatment development and implementation that can be completed by an occupational therapist. All right, so for the introduction, occupational therapy is defined as therapy that's based on engagement in meaningful activities of daily life to enable or encourage participation despite any impairments or deficits, and that's from Merriam-Webster Dictionary. It focuses on the entire person as a whole, so it's more so a holistic view, not just their disability, not just the impairment, but you want to focus on the entire client as an entire person. And then occupations are basically what we consider as play, work, leisure, rest and sleep, social skills, ADLs, so activities of daily living, IDLs, stuff like that. And then the goal of occupational therapy includes restoring or developing independence in meaningful occupations, so whatever is important to the client. And then OTs can work in schools, hospitals, outpatient clinics, skilled nursing facilities, home health, and even, for example, here.
Okay. I think that's the next slide, right?
Yeah.
Okay. Before practitioners are able to intervene and kind of improve the performance of activities of daily living, ADLs or IADLs, they must first evaluate the patient's performance, kind of collecting like a baseline. And so this is why evaluating clients through assessments is really important, because you need to have a way to kind of measure the client's growth. These assessments can identify some of the underlying causes for performance deficiencies, and they can also inform the treatment plan for the patient or client in the facility. So we can go on to the next one. There are a couple different types of standardized, assessments. There's a standardized and there's a non-standardized. And the standardized is actually kind of like the gold standard because it has a uniform approach, and you're able to establish kind of like a level of comparison between people, and it's much more reliable. Whereas the non-standardized is usually less reliable. It's difficult to kind of measure whether or not there's any growth of the patient or client, and it's usually something that the practitioner or therapist created too. So I just wanted to go over that as far as those two types of assessments, and I think Teresa will go next.
Okay, so I'm going to talk kind of about what kind of assessments there are in the therapy world. So occupational therapists can use a variety of assessments, standardized and non-standardized, like Tiffany had mentioned. And there are a variety of assessments that can measure different things in clients, such as their life satisfaction, maybe their depression, their cognitive functioning, their ability to function in activities of daily living, and maybe like anxiety. Specifically for Mount Zion, we think that conducting cognitive functioning assessments would be really beneficial here, especially when clients are first new to the program, and we can see kind of the baseline of where their cognitive functioning is, so that we can work to implement different interventions and activities that can maybe increase and benefit them and maintain their cognitive functioning. So I'm going to describe a few different assessments that assess cognitive functioning that an occupational therapist could use in this facility. So the first one, the mini mental state exam, I think you had seen it when we did our group protocol, but this one measures like orientation to time and place, a person's ability to recall, their attention, their language. And so as you can see, there's like two different ways that the scoring will show of the client. It'll show either the level of cognitive impairment in the client, or it might show the odds of dementia in that client based on the scoring. Another cognitive assessment is the MoCA, the Montreal Cognitive Assessment. This one also assesses like short-term memory, visual, and spatial ability, their attention, their concentration, their working memory. And this one, a 26 on this assessment would show that a client is normal. And then in some studies, those who have mild cognitive impairment score around a 22, and those who have Alzheimer's would score about 16. So just based on those assessments, you can get those scores and kind of see where your client is at. The last one I'm going to talk about is the Allen Cognitive Level Screen. This one's a little different, so it's not just question and answer like the other two. As you can see, it's kind of a physical task that the client is going to be faced with. So it's a variety of sewing tasks, and this will show the client's ability to make decisions, their functioning, their ability to function independently, their safety, and etc. And so this particular assessment just asks them to do a variety of sewing tasks. And based on their ability to complete those tasks, then there are like 6 cognitive levels that the occupational therapist could place the client at.
Okay, so we wanted to spend a few more minutes talking about the ACLS just because it's an assessment that we think clients at Mount Zion might benefit from. And it's mainly because it's such a unique assessment compared to other cognitive assessments. This one does not involve a whole list of different questions that you're asking the individual. Instead, as Teresa explains, it involves using your hands and following directions and doing different sewing stitches. And so it's actually able to evaluate cognition based on how they're able to follow directions. And it's actually, it's kind of, I guess, graded to where it's more difficult. You get to more difficult stages with the stitches. So you're able to kind of assess that for the patient as well. The results of this assessment are also much more practical than the other question assessments, in that it actually corresponds to the level of supervision and care that a person would need. And I think that's in some ways probably an issue for some of the different clients and patients here at the center. So it's able to kind of give you a little bit more insight into their ability to function in daily life activities.
So, okay, so what would be a good reason to have an OT here? Well, not just because we want jobs. Of course, you would hire us, but you would want an OT in this setting so that they can read these assessments and then decide what type of implementation that they would do for a treatment plan. For example, if a patient comes in and we do a cognitive assessment and we discover that they're borderline on the dementia scale, she would start to develop implementation activities where she would have the patient recall certain things, develop things like memory tasks, just things that they could do that would exercise their brains and keep them, from scoring lower on the test. She will also keep up with, she or he will also keep up with how long they can go with doing certain tasks before the brain clocks out. What's safe and what's not safe for them to be able to do on their own so that they can keep their independence and still be able to function on their own, but also when and where they need help and how to identify it. The finding of these cognitive assessments, like I said, they allow us to do these treatment activities, and they're all for the benefit of the client, but they're client-centered around what the client wants to do. It could be something simple like a word cross, which a lot of the clients here like to do, but a word cross that's nostalgic, something that could spark interest in their past, something that they used to like to do. Yes. So the benefit of an OT here would be that the patients here a lot of the time are stuck in this one space. And even though it's not a negative thing, you want them to be able to get up and move and be more active so that they can stay active on their own. You know, you don't want to get into the habit of doing everything for them. You want to make sure that they have their independence and that they can participate in activities that they want to do, and allow them for it's like self-empowerment and things like that. Yeah. So an example of something that an occupational therapist could do in this setting would be a mailbox intervention. So a lot of the patients here do have or is borderline dementia. So intervention that an occupational therapist could do here is to create a mailbox intervention, which you could set up in any room. And what she would do is assess the clients, and in these mailbox, it would be completing an IDL, so an independent activity of daily living, where they would get up on their own, go to their mailbox, and check their mail. And inside of their mail, there would be, let's say someone has an issue with cognitive functioning and problem solving. There would be problem solving activities. Or if someone has issues with memory, there would be a memory activity and things like that. And so through this intervention with the OT, she can keep track of how they're developing throughout their time here, through their duration here, make sure they're not slipping forward or what we can do to prevent them from slipping deeper into dementia. And then they can also put their own input inside of their mailboxes. So if they, for example, would like to write the OT a note and say, I'm interested in this, they would put it in an envelope, put it in their mailbox, and the OT will receive it, and then she or he can then develop an intervention around that.
So just diving deeper into this mailbox intervention that an OT could implement here. So OTs really focus on the therapeutic use of occupation. So kind of like what Elena said in the beginning, rest and sleep, leisure, play, social participation, IADLs such as caring for pets, meal preparation, or religious expression, things like that. So an OT would kind of look at each individual and what their interests are, what occupations they find meaningful, and kind of gear what kind of letters they get in their mailbox based on those interests and those meaningful occupations that they want to participate in. So, for example, I mean, the people here at Mount Zion, love to express their religion and their love for God. So, like, things like daily prayers, devotions, Bible verses, things like that could go into their mailbox. Or if you wanted to work on leisure participation in a client, then we could give them word searches, crosswords, Sudoku puzzles, or like newspapers. For IADLs, the OT could give pamphlets on like how to prevent falls or how to manage their medicine. And social participation, an OT could kind of have conversation starters, table talk. So the client could come in, get their mail, get this little conversation starter, and go sit in the room and talk to their neighbor about whatever the table talk topic is. There could be meal or snack ideas that a client could do at home, or there could be like daily challenges that an OT could put in there that could target a bunch of different occupations based on the needs of that one client.
Okay, so in conclusion, occupational therapy is a form of therapy that focuses solely on the client and the occupations or activities that are meaningful to that client in order to regain their independence. The client evaluations and treatment plans are significant when improving the quality of life and measuring the growth of the client. So like they were saying, you would take it at baseline, then take it kind of in the middle, and then at the end. And also, there are various forms of assessments that can be administered from an occupational therapist that will benefit the clients here. And, okay, so meeting our learning outcomes. So, this is your time to answer some questions. Okay, so what do you think now, like after, not already what you knew before, but now what do you think occupational therapy is as a whole?
Interesting.
Interesting, okay.
Very interesting. I wish that I had someone here that also could help not only with the OT, but to help develop my activity coordinators, that they could do a better job in getting them more energetic and involved. You know, getting them up more. You know, instead of me having to go, they've been sitting too long. Come on, let's. You know.
Mhm.
So I think it is a very positive and strong outcome, and every facility needs it. Every facility.
And if you can't have the position, there are consultants that probably can come into and also help. So with what you were saying, like activity planning. So
Yeah, I think it's good, especially with the mailbox thing now. It's just ringing all in my head now. I mean, just that right there is a kicker. But I think what the occupational department does is so positive and so much needed. You know, we got everything else, but that you have some careers that kind of get overlooked. Some people deem, well, it's not important. Yes, it is, especially with dealing with dementia and Alzheimer. It is vital, you know, that we try to, and I'm going to see if I can get a grant written to try to hire somebody that will help out, you know, because in the adult daycare, there are so many, we have an umbrella. And there's so many departments needed up under that umbrella to take care of the older adults, to give them a better quality of life, you know. So it's just not having an activity coordinator. There are other things, and just not having the nurse there and the director there, but there are other things that are needed to make this umbrella a secure and sustainable umbrella. So just to help the seniors and well, people, because we're getting younger people now with this dementia and Alzheimer, but it is much needed. So I have some work to do. Yeah, because it's needed.
You kind of answered
all the questions.
All of them. The next one was the benefits of OT and older adult setting. You got that. The importance of the occupation is basically what's meaningful to them. Got that. The importance of standardized cognitive assessments. Got that. And lastly, the importance of treatment, development, and intervention by OT.
It's needed.
I'm excited that you like that mailbox intervention. That's something that we just so happened to stumble upon that we thought is occupation-based and they could do just naturally. Because you don't think that going up and checking your mailbox is independent activity of daily living because we do it out of habit. But for them, it's something that they might not be able to do anymore. And then for them to be able to get up and be active and do an occupation that's meaningful, and because it is adult daycare, also nostalgic, it brings back those memories. It gets that brain functioning, and it allows them to have that nostalgia moment and go, wow, I used to do this on my own every day. And that's something that an occupational therapist would be able to do and better each time the client comes and checks their mailbox. Something as simple as that, but it's so meaningful to the client.
And then you have some that might truly just forget, you know, and then they see in other people, and then they might question, well, why did you go do that, you know? And then that sparks that. In that long term, oh yeah, I forgot to go do my mailbox. And, you know, so that's something that the OT can also evaluate, you know, to see if we can figure a way, how do we speed up the process of her knowing that I got to do this? You know, what do we do to pull out of that long term? It's needed. And I got to go grant digging because I need it. I mean, seriously, I need it.
So these are our references. And lastly, we just wanted to thank you for allowing us to come. Thank you for your time during this presentation because we know you're busy.
Thank you.
Thank you.
Thank you guys. Oh my God.